Welcome to this channel. We want to talk about how the just approved CRISPR drug cures sickle cell disease. Firstly, we'll remember that recently the US and the UK regulatory bodies just approved a CRISPR drug to cure sickle cell disease. So we want to talk about how this drug works. Firstly, let's talk about what sickle cell disease is all about. Sickle cell disease is a genetic disorder that affects the red blood cell, which makes them to become sickle shape. And majorly, they are characterized by anemia, by periodic episode of pain, by painful swelling of hands and feet, by frequent infection, and also by delay in growth. Also, it also affects their vision. This leads to a lot of complications, such as cerebrovascular accidents. We have the acute chest syndrome, we have the pulmonary hypertension, we have the organ damage, we have the blindness, we have leg ulcers, and then we have the gallstones. Now, about 75% of sickle cell birth is in sub-Saharan Africa, and 44% of them are actually accounted for by countries such as Equatorial Guinea, Benin, Burkina Faso, Nigeria, Sierra Leone, and Togo. The sickle cell disease-related death has been put at over 300, while the cause-specific death, through sickle cell have been put at 30,000. Now, let's look at the basic genetics of sickle cell disease. From chromosome 11, where we have the globin gene, we have an extract of the sequence, the DNA sequence from there. And from there, we know that, okay, some of these, we have the corresponding RNA sequence, which leads to production of some amino acids. And this amino acid will eventually lead to the alpha and beta hemoglobin. Okay, so this subunit forms the hemoglobin A, and this makes the red blood cell to be normal. So in this case, you have the normal red blood cells carrying the oxygen around the body. But we have some aberrations sometimes where we have a mutation that at this point that we have the GAG, we are having a GTG here. And of course, this will lead to a corresponding RNA. Instead of having GAG, so we're now having GUG. When you have the GUG, so instead of having the glutamic acid, you're having valine at this point. So we're having valine here. It's definitely going to lead to hemoglobin S. And this hemoglobin S will lead to production of that sickle cell shape. So this sickle cell shape is going to affect the flow of oxygen around the body. And they are also very fragile. They might not live long. And all this can lead to the complications that have earlier been discussed in this video. Now, where does the CRISPR come in? Now, before we talk about the CRISPR, let's look at this. Don't forget that we have the fetal hemoglobin. The fetal hemoglobin is actually the hemoglobin responsible for the transfer of oxygen from the maternal side to the fetus during pregnancy. And even after birth, it's still this fetal hemoglobin that is still responsible for the transmission of oxygen around the body. This fetal hemoglobin is actually made up of the alpha and the gamma subunit of the hemoglobin. But after birth, some weeks after birth, you have a transcription factor called the BCL11A. The BCL11A is actually responsible after birth to suppress the production of the fetal hemoglobin. And so we now have the expression of the alpha and beta subunit of the hemoglobin, which gives you the HbA hemoglobin. The BCL11A is a transcription factor that is responsible for the repression of the HbF. Now, in the case whereby we have a mutated hemoglobin already. Okay, and then we already have valine instead of having a glutamic acid, and we already have hemoglobin that is producing a sickle cell. So how it's being treated is that a stem cell will be taken from the patient, and that stem cell will now be edited by using the CRISPR system. CRISPR system where we have the Cas9, and then we have the guide RNA, and then we have the PAM sequence. Okay, because the Cas we cut while the guide RNA leads to specificity on where to cut, and PAM sequence is the sequences that we count before the cut of the Cas9 in the CRISPR-Cas9 system. So when this CRISPR-Cas9 has been used to disrupt the BCL11A, so the BCL11A that's supposed to actually be responsible to suppress the fetal hemoglobin, we then will not be able to do that because the BCL11A itself will be suppressed. So since it's been suppressed, we now have the expression of the fetal hemoglobin. So the fetal hemoglobin will now be the one to be doing the major responsibility that's the HbA, but now that's been mutated to HbLs has been doing. So it's the fetal hemoglobin that will be doing that. And what is the fetal hemoglobin? The fetal hemoglobin is a hemoglobin found in fetus and newborn, and it's made up of tetramer with 2 alpha and 2 gamma chains, and it has a higher affinity for oxygen than the HbA. So it's able to transport oxygen around the body. And it's also important to know that it transfers oxygen from maternal to fetal circulation across the placenta during pregnancy. Success rates of this CRISPR drug on sickle cell has been very, very remarkable. We have about 97% of the success rate. However, we have some side effects, which includes but not limited to, if we have fever, we have nausea, we have fatigue, we have increased risk of infection. But having said that, there have been no significant safety concern whatsoever that have been reported for this CRISPR drug. I think it's a major breakthrough because this technology is now going to be deployed for other disorders to see to what extent they can be cured as well. Okay, thank you very much for taking out time to watch this video. And if you know that you have benefited from this video, I want you to do a favor by subscribing to this video, and then ensure that you share, you like this video. Thank you very much once again.